Welcome. Hi, my name is Sue Bernardin, and I'm the Associate Director of Gift Planning at St. John's University. I work alongside Susan Damiani in the Office of Gift Planning. So welcome to our virtual Power Hour, which is brought to you by the McAllen Society. The Power Hour series was created in April 2020 to bring together experts in the fields of, health, technology, to bring together to just to showcase, what our alumni are doing. And today we have Dr. Judith Beizer with us, who is a clinical professor at St. John's University's College of Pharmacy and Health Sciences. Dr. Beizer previously served as the chair of the Department of Clinical Pharmacy Practice at the university and the assistant chair of the Department of Clinical Health Professions. Dr. Beizer currently serves as the clinical pharmacist at the Stern Family Center for Rehabilitation, which is a long-term care and subacute rehabilitation facility in the Northwell Health System. In addition to that, Dr. Beizer serves in a variety of organizations around the country, and she's currently a board member of the American Geriatric Society and the AGS Education Committee. She also serves on the Geriatric Workforce Enhancement Program. She's also involved with the American Society of Consulting Pharmacists. So as you can see, Dr. Judith Beizer is a very, very world-renowned pharmacist, and we are so fortunate to have her at the university and teaching our next generation of, pharmacists. So without further ado, I'm going to send it over to Dr. Beizer. Welcome.
Thank you, Sue. So today I'm going to talk about really how to manage your medication and how to talk with your pharmacist. So I'm just going to fix my layout here so that I can see myself. Okay. And talk about questions you need to talk with your pharmacist about, and also things that are just kind of the do's and don'ts. Some of the things are very logical, but many people don't even think about these things, and I'll take time to answer any questions for someone. So the one thing I always like to talk about, just to make sure we're all talking about the same thing, is that when we talk about medications, I'm talking about not just prescription medications, but also talking about over-the-counter medications and supplements, vitamins, minerals, because these things can have effects on the body. And it's important that when you do talk with your physician, when you talk with your pharmacist, that you mention all of the other products you're taking, not just the prescription medications. The other thing that we're going to talk about is how to choose your pharmacy also, because that's just as important to make sure that all your prescriptions and your over-the-counter medications are coming from the same place. We'll talk a little bit about drug interactions and side effects and things, but those are things that a lot of times are very specific, and that's when you're going to ask your pharmacist about, can you take these different medications together? Are there specific timing of medications that you need to be worried about? And can you combine some of the medications? So I want to talk about the role of the pharmacist, because that's something very obviously close to my heart, since I'm teaching, as she said, the next generation of pharmacists, and been doing this for quite a long time. So for those of you who are really not familiar with the education of pharmacists these days, all pharmacists graduate with a PharmD, or Doctor of Pharmacy degree. Now at St. John's, that we have what right now is called a 06 program, where the students come in right from high school. They do 2 years of pre-pharmacy type of work with a few little pharmacy courses added in, and then 4 years of what we call the professional years. In other universities, they may come into the professional years with either a bachelor's degree in science, or they may have just done their all their pre-work in 2 or 3 years. But all the pharmacists coming out were at least 6 years of schooling, and many of our graduates also go on to do residencies in the hospital. So if you're dealing with any pharmacist in the hospital, many of them have done a year or even 2 years of a residency after graduation. So what is it that the pharmacist can help you with? Really, they're your medication specialists, and they're the people that you need to talk with when you have questions. When you have a new medication, we'll talk about what the pharmacist offers you as far as information. And can help you in choosing your over-the-counter medications as well. They also can help you advise on whether a medication is appropriate for you in a generic formulation or not. Help you if you have certain allergies, and it's not just allergies to medication, but if you're allergic to certain food dyes that might be in medications, the pharmacist can help to make sure that you're not getting anything that you're allergic to, and make sure that you really understand how to take your medicine. And so when you're in the pharmacy and the pharmacist says, can I take a few minutes to explain your medications, please say yes. Please take that time and listen to what the pharmacist has to say. Yes, we do, staple something to the bag and give you that written information, but it's always good to hear it as well as then go home and read about it too, and then give you the time to ask questions. And if you do use a mail order pharmacy, know that there is always an 800 number that you can call to talk with the pharmacist in the mail order pharmacy to answer your questions. And if you have to use a local pharmacy and the mail order pharmacy, you do want to make sure that the pharmacists on both ends know what you're getting from the other site so that we can check for interactions as well. So let's just start off with even choosing a pharmacy. And the one thing that I always say, and this is something that's been true all along, is convenience. You want a pharmacy that you can get to, that's open the hours that you need to be there. And you want a pharmacist there who's going to be responsive to you, who's going to be friendly and knowledgeable and take the time when you have questions. Now, I know today you go into any pharmacy, particularly some of the bigger chain pharmacies right now, are super busy with giving vaccinations and counseling people on COVID tests and trying to then just do the everyday filling prescriptions. And it can be chaotic at times. I was in a local pharmacy, a few months ago, and I really felt bad for the pharmacists on how they were trying to juggle all the different things that were going on there: flu shots, COVID vaccine, helping people with where they're, what they were trying to find. So you want a pharmacist that's responsive to you. If you need it, you also want a pharmacy that offers a delivery service, if it's a local pharmacy. You want to make sure, what's very important is that your pharmacist takes your insurance. There are different, if you're Medicare Part D, there are about 19 different plans in New York, and they have lists of pharmacies that are in network, but they also have preferred pharmacies. I was just chatting with a friend the other day and couldn't believe that when they switched pharmacies, because the one pharmacy that they've been using didn't have their father's product, they found that they were paying a lot less in the copay. And I said, that's because probably the newer pharmacy was in a preferred. And so it was a difference in a $100 copay versus like $42 copay. And that can make a big difference. So make sure that you're using a pharmacy that's not only within the network, but also a preferred pharmacy. It's also a good idea that the pharmacy that you choose is where you buy your over-the-counter products, so that you can talk with the pharmacist about whether it's safe to take your prescription medication with this particular over-the-counter medicine, or ask advice about vitamins or other supplements and what you might need. I used to always talk about making sure that the pharmacy is neat and professional looking, and I think that's still kind of true, and that you want a place that you trust all around, and that trust with the pharmacist is what's really key. So one of the things that I always ask, and this is something that if they haven't sent it out already, we can send it out to you after this program, are questions that all patients should ask about their medicines. And this is particularly asking to your pharmacist. You can ask them to your physicians too, but the pharmacist at the time of dispensing is really a good person to be asking this. And the first thing is to really just ask, what is the name of the medicine and what is it supposed to do? And most people think, well, that's, this seems obvious, but not everyone, knows what the medicine is for. They say, well, it's for my heart. It's that little white pill for my heart. Well, there's a lot of little white pills, and there's a lot of different things it can do for your heart. And hearing the pharmacist also say the name, either the brand and or the generic, and how it's pronounced can also help you when you're trying to maybe talk to your physician about it. Sometimes I had patients who mentioned a drug name and it's so mispronounced that I wasn't even sure what they were talking about till I saw it in writing. So ask what it's supposed to do. If you can remember both the brand and the generic, it's written on the bottle, but you want to know what it's for. The second question is, when and how do I take it? So for example, for oral medications, you want to know, can you take it with food? Or should you take it on an empty stomach? And if we say an empty stomach, we generally mean an hour before or 2 hours after a meal. So that's important. Some medicines need to be on a totally empty stomach, which means first thing in the morning before you even have your cup of coffee. Only take it with water and then wait. So it depends on the medication you need to ask. And if it's not an oral medication, you want to make sure you know how to use it and where to put it. So there's a number of different inhalation devices. Make sure if you've never used it before, don't be embarrassed. Don't be afraid to ask the pharmacist, can you help me, take my first dose here? Show me, the steps I need to take this medication properly. If it's a cream or an ointment, make sure you know where to put it and how much to put on. A friend of mine called me one time at home. She said, this is an embarrassing question. I just came home from the doctor. I got one kind of ointment he said to put right under my eye, and the other one to put on, her elbow or whatever was itching. She said, I don't remember which one is which, and I don't want to put the wrong ointment in the wrong spot. So make sure you know where things go. Third question is, how long do I need to take it? Is this a medicine that you're going to be getting refills for and you can maybe taking for many years? Or is this a medicine that it's a one-time, like an antibiotic for 10 days and then you're done? And if it is an antibiotic for 10 days or whatever, make sure you take all 10 days. Don't stop taking it just because you feel better. Fourth thing is to ask if the medication contains anything that can cause an allergic reaction. And this goes back to making sure your pharmacist knows what you're allergic to, whether it's a medication, even some food substances or food dyes, because we can make sure that you're not getting anything that you're allergic to. Ask if you should avoid alcohol or any other medicines, foods, or specific activities. So I'm never going to tell you it's okay to take your medicine with a glass of wine or a beer, but ask, if you, in these days with COVID, who's going to parties, but still you might be having a glass of wine at home or on a Zoom party, and ask, can I have some wine? Can I have some beer? Some medicines it's okay. Some medicines, if you combine alcohol with your medication, will make you terribly drowsy or make you very sick to your stomach. Not a good thing. Ask about other activities. Can you drive with this medication? So if it's a medication that causes drowsiness, we will put a little label on there. It's usually the print is very small. It says don't drive or operate heavy machineries or engage in dangerous activities until you see how this medicine affects you. So the driving is pretty self-explanatory. What do we mean about other activities or dangerous equipment and things? If you're a forklift driver or something like that, or even if you're an older adult getting up onto a step stool or reaching up for something on a high shelf, if this medicine causes drowsiness or affects your balance, that could set you off balance. You could be at risk for falls. So you want to know to wait and see how this medicine makes you feel. And sometimes we'll tell you, take the medicine in the evening because it will cause drowsiness. As you said, other medicines and foods, that's something to ask the pharmacist, and generally we'll put on that, take with an empty stomach, or some things they'll say take with food to make sure it doesn't irritate your stomach. Ask about side effects. We're supposed to tell you about them. We print them all out on that piece of paper that's stapled to the bag, but you want to know to expect which ones are serious and you need to call the doctor immediately, which ones are expected ones that will generally go away, what to do if you have any of these side effects. What if you miss a dose? I'm never going to tell you to double up on a dose, but you have to use a little bit of common sense when it comes to missing a dose. So if it's more than half the time till your next dose, just skip it, start over. But if it's a morning medicine that you take once a day and you remember at lunchtime that you didn't take it, you still have time to fit it in today. If it's dinner time or bedtime, you realize you didn't take your morning medicine, just skip it and tomorrow start over again. But you always ask about specific medications with the pharmacist. For younger people, we ask, particularly women of childbearing age, if it's safe to become pregnant or breastfeed while taking this medicine, because we know that certain medications can affect the unborn child or affect the nursing, the breastfed infant, and even in men who are planning on becoming fathers, that certain medications may affect fertility. And so you want to make sure that this is okay if you're planning on parenthood. Ask about generics. The pharmacist is usually the first one who will know whether there's a generic version of your medication and if it's appropriate for you. And they then will talk with the doctor about getting the prescription written as a generic rather than brand only. Now, the interesting thing with certain insurance companies is that when a medication first becomes generic, the insurance company may have a deal with the brand company and still only cover the brand and give you a fairly good deal on the brand. And if you try to order it by the generic, may not cover it. So you always want to check with the insurance company to see which version they will accept and which one they'll take. That brings up a question about generics, because I know a lot of people have concerns, and particularly in the last several years, there have been a number of books written about, our supply of medications and the raw products from China and other countries, and are generics as good? I will say that even despite some of the things I've read that I will admit are scary, I still believe in generic medications and believe that they offer a good, cost-effective way of treating your diseases. So it's a discussion to have with your physician and your pharmacist. There are certain medications that I will say that have a very small dose, and a little bit higher or lower amount could make an effect as far as the control of your condition. But for most medications, I think you're fine with a generic. The other thing is, if you're buying over-the-counter medicines, to look for what I call the house brand. If you're in Walgreens, CVS, or even a local pharmacy, they will have some generic versions of, say, Tylenol. And if you're confused about what's what, again, ask the pharmacist. The one thing I will say is also look at we'll talk about expiration dates a bit, but look at the expiration dates of whatever you're buying, whether it's brand or generic, and make sure that think you're saving a lot of money by buying a really big bottle of whatever. But if you're not going to use it up by the expiration date, then you really haven't saved any money. So asking about generics and making sure that you're picking the equivalent product. I know I was looking one time for just plain generic acetaminophen, round tablets, 325 milligrams, and trying to find that versus all the other versions of acetaminophen was getting a bit confusing. The last question you want to ask your pharmacist, I mean, there's certainly more questions you could ask, but about any special storage requirements. The medicine cabinet in the bathroom is the worst place to keep medicine. Shouldn't be called a medicine cabinet. It's too moist in there, the humidity from taking a shower, it gets warm. So most medications should be kept in a cool, dry place and out of the reach of children, and keep it where you'll remember it. You want to put it where you will remember to take it. That's probably most important, and out of the reach of children. If we say refrigerate, then you put it in the refrigerator. If we don't say refrigerate, do not keep it in the refrigerator, because that's also a fairly humid environment as well. So those are some of the questions to ask. And then I have what I call my list of do's and don'ts. And again, this is something that Shu can send out too, because I provided it with her. Because there's a number of other things that just are logical things to think about when taking medications. And the first two things on my list, which many people think are kind of obvious statements, but not everyone thinks of them that way, is to never take someone else's medicine or offer yours to someone else. Don't share medicines. And what I find is it's not so much, people sitting around saying, I'll trade you a blue one from one of my green ones, but it's within family members. And I know that sometimes people are trying to be helpful and saying, oh, you can't sleep here, take one of my sleeping pills. That sleeping pill wasn't intended for you. It's for that other person. You don't know how it'll react with your medications. I tell the story from many years ago when I first came to New York, and I was working up at Montefiore Medical Center and doing home visits as part of a study. And we were asking people about, do you ever share medicine? This woman said, oh no, Dr. Beizer, I would never do that. That's so dangerous. And then as I was going through an inventory of the medications in her home, there was a bottle of medication with somebody else's name on it. And she was the only one who lived there. I said, well, who's this? Oh, that was my dear departed husband's pain medicine. He died, 8 years ago, but this is the best pain medicine. So we got a problem here. Even though he's dead, you are still sharing medicine. You're taking his medicine. It wasn't intended for you. Second thing is that it's 8 years old. And it's obviously probably beyond its expiration date. So that leads into the next of the do's and don'ts. Never keep expired or discontinued medications. Dispose of them properly. And we say that meaning empty the vials and the bottles into the garbage, mix it with something disgusting in the trash. don't flush them. We used to say flush them, but we do not want you to flush medication. So just empty it into the trash, or if you have some coffee grounds or kitty litter, you can mix it all in with that. So let's talk about expiration dates. Over-the-counter medications have, and vitamins and things, they all have expiration dates. And I try to believe them. I try to go by them. And people go, oh, you can still use it. Think about milk. You buy your milk, it has an expiration date or a sell-by date, and you go to your, you need milk for your coffee, and you look at, oh, it's expired. What do? You smell it, right? You maybe taste a little bit of it. Okay, it still tastes good, but you're probably going to buy some more milk, right? Same with medications. You can't smell or taste them if they're bad. The only one that really often smells bad is aspirin. If you have an old bottle of aspirin, take a good whiff, and if you smell a lot of vinegar, then it's turned, okay? But most other medicines, you can't tell. They may not harm you, but they may not be as effective. So I go to my cabinet where I keep my generic Tylenol, acetaminophen, and I have a headache, and I go, oh, it expired at the end of December. Today's January 24th. Okay, I have a headache. I'm going to take it, but on my list, I'm going to put 5 more acetaminophen because I want fresh stuff. I want it to work when I need it. So that's over-the-counter medicines and things. Prescription medicine, when you get a prescription filled, you'll see that it'll say don't use after, it'll usually have a year date on it. And that's because the government, they required us to put that on there. But in real life, if I'm giving you a prescription for, say, 3-month fill, if I see that my stock bottle is going to expire within the next 3 months, I can't dispense that to you and say there's an expiration date of next year. That would be wrong labeling. So for most times when you get a prescription from the pharmacy for 1 month, for 3 months, you don't have to worry about the expiration date. If it's something that you take only as needed and it's sitting around, if it's still there after a year and you still occasionally take it, that's when you want to get a new prescription for it. So, and that's when you could then toss it. Okay. If it's a medicine that was discontinued because you didn't tolerate it, the doctor said you didn't need it, whatever it is, don't keep it around just in case. You didn't tolerate it, no one else was going to use it, throw it out. A couple other things. Just never mix more than one medicine in a medicine vial, because sometimes, God forbid, happens, you're in an accident, we find this prescription vial in your purse, your pocket, and we think that's all that's in there, and then we open it up and find several different color pills, and we don't know what you're taking. I will show you some pill boxes that can help you remember to take medication. Those are good for keeping them together for a week. When you're traveling, always keep medication in the original container. So again, if something happens while you're traveling, we know exactly what you're taking. Or you say spill those medicines, or you get delayed and you run out, and you could go to a pharmacy and they could, if it's a national chain, they could fill it for you, or they could find out, call your doctor, get a new prescription for you. Never take medicine from an unlabeled container. Don't assume you remember what's in there. Always follow directions, and when you don't understand, please ask questions. Ask questions of your doctor, ask questions of your pharmacist, don't guess. We talked about some of these other things. Also, don't expect that when you start taking a medicine, you're going to immediately feel better. Sometimes you might not even feel anything. Sometimes you might even feel a little worse if you're having any side effects from initially starting a new medicine. And don't stop just because you feel better, unless that's what the doctor told you to. We talked about missing doses, always keeping medicine out of the reach of children, particularly if they're non-child resistant caps. And remember, they're only child resistant, not child proof. And sometimes your grandchildren or other little kids can open those child resistant caps faster than you can. And if you need an easy open cap, please remind the pharmacist. Don't wait till you get home and realize that you have a bottle that you can't get into. I've been in homes where people will say, well, I finally got the bottle open, so I kept the cap off. Or I put it into a jelly jar or a Tupperware container, or I moved it into something else, an old prescription bottle. Keep it in the original container and make sure that you can open it. Keep a record of side effects and allergic reactions. So allergic reactions are generally when you break out in a rash from a medicine, or in the worst case, your tongue swells, you have trouble breathing. And those are things you want to obviously always tell the doctor and tell them what kind of reaction you had. Side effects, sometimes they can be that bad and you never want to take that medicine again. But side effects, certain things can be like you get diarrhea or you get nauseous, you get drowsy. Those are things that we expect from the medicine. And over time may go away, or we can adjust how you take it with food, take it after a meal. It's drowsy medicine, take it in the evening. So make sure that we know what these effects are, because what happens if you say I'm allergic to a medicine, we're going to avoid that whole medicine and even some other ones related to it when you might really need it, and you really could take it safely if we give it to you in the correct format. Oops, I got to move more or my lights go off in my office. Sorry. Okay. Always read the label too, particularly if you have several different medications. Make sure you're picking up the right one. Make sure you're taking it correctly. I have so many times telling people, oh, I see the label says twice a day. And they go, twice a day? I've been taking it once a day. I thought it was always once a day. And they're never reading the label. And please don't ask the doctor to put down like 3 times a day so that you can get 3 times the amount for one copay, because even though you take it only once a day, because what happens, you come into the hospital and they read that label, they start giving it to you 3 times a day. I've seen that. And that's actually insurance fraud. Keep an updated list. People have pocket cards. When we in non-COVID times, when we do these talks on in person, we have cards that you could fold up, put into your wallet. You have St. John's logo on it. People keep lists on their phone, but make sure it's then in a way that we can access it if you're unconscious or you can't open your phone. But keeping an updated list in your wallet or your purse is always a good thing. Show it to every doctor, dentist, ophthalmologist, whoever you're going to make sure that they know what you're on. Make sure all your prescriptions are going to the same pharmacy so we can check for interactions and then call the doctor if there's an issue. And also remember that medications are only one part of good health. They're not a substitute for feeling good. Proper diet, exercise, socialization, as much as we can do these days, really are all part of making you feel better. And remember to ask questions. There are no stupid questions when it comes to medications. So now it's time to remember to take your medicine and think about the ways, different things in medicine. So the simplest thing is like a pill box like this. It's got the days of the week on it. I like this one because it's a nice contrast. You can see some of them are clear. You can actually see, did I take it or not? It even has Braille on it. It has raised letters, snaps open nice, clicks nice. If you're taking medicine more than once a day, you might want a tray that's like this. Let me get it right in there, okay? And each day comes out. So if you are taking medicine in the middle of the day, you've got the day, each one is labeled. One of my students gave me this nice color-coded one. And it's larger, so if you're taking more medicines, there's all different kinds of shapes and sizes of these things. Okay, and each day has a label on it. So it can tell me when it has pictures of, the sun rising, the sun in the middle of the day, a moon in the bed. And then there are just some fun ones that I found online. This one, each little capsule comes out. So I can take it for the day, and it has 2 slots. Kind of cute. Whatever works for you. Then there's the giant size one. This one gave this to me filled with chocolate. And then there are other gadgets to help you if you have to cut pills in half. Truthfully, the pill cutters that kind of snap, I found sometimes they're difficult. They got a little razor blade in there. You put the tablet in there and snap, and if you're lucky, it goes. Some of them snap easy with your hands. Don't cut too many at once. So I'll give you an example. My husband is on a medication that I have to cut some of his tablets. I just cut them for a week. fill the box, and the rest of them I leave, whole. Because if you break the whole bottle, you're going to end up with a lot of crumbs at the end. The other thing is for some people, particularly some older patients who may not be able to swallow medications whole, there's a pill crusher. So this thing has a pill cutter on top and a pill crusher. Put the medication in, and it crushes it, and then you can put the powder in, mix it with applesauce or pudding. But before you ever cut or crush medications, you want to check with the pharmacist, is it okay to crush this medication? You never want to crush a controlled release or a long-acting version of a medication, because then you break that long-acting version. If it has a line down the middle, that means you can cut it along that line. So if you needed to, like, say, take smaller pieces of it, but never crush. And there's different sizes and shapes of these things. There are also beepers and timers. So some people have timers set on their phone. This was a pill vial that had a timer built into the cap. You could set the time of when you want to take it. It would tell you when you last took the top off. So there's all kinds of interesting gadgets. There are gadgets that are attached to phone lines for someone who needs some kind of reminder that if they don't take their medicine, it'll call their next of kin, who can then call and say, hey, I got the alert. You didn't push the button to take your medicine. Why don't you take your medicine now? Is everything okay? They can also be useful if someone has a home attendant who's not supposed to administer medicines, but can assist. So they can say, okay, the timer went off. Let's go get your medicine. It's time for you to take it. If you're taking eye drops can be sometimes tricky, and they go down drip down your face. There are eye drop guides that you can buy at the pharmacy or ask about them. And it fits on the bottle so that it props up against your eye. And then it can help steady your hand and helps you kind of direct it into your eye. If you're measuring a liquid, whether it's for an adult or for a child, you always want to measure it with a measuring spoon or a medication spoon. Do not use the teaspoon from your silverware set, because that's, it depends on your silverware set how big it is. So there are all kinds of dosing spoons. This is a cylindrical spoon that some kids like. It's marked off. There are syringes for babies that for very small amounts. You want to be accurate. The medicine cups are for bigger amounts. So like if you were taking something that it's not as accurate, you're taking some Maalox, something like that. So those are some of the key things that I really wanted to talk about today, and I'll take some questions. And we can, I can go a little bit into some over-the-counter products too, if you want, but I just saw that there was a question there. Can you put it back up, because I did not.
Sure. It's located in the chat box. I can read it to you if you like.
Okay, chat. Okay, got it. I see
Okay.
it. Okay, let me just closing a few. Okay, got it. Okay, so what is the ideal time of day to take my prescription drugs? Okay, so, and they got a list there. So atorvastatin is one of the statins used for cholesterol. Some of the statins are shorter acting, and we always say take it in the evening because that helps better, because that's when your body's kind of producing more cholesterol. Atorvastatin, truthfully, is a longer acting one, so it's not as particular that you have to take it in the evening, as long as you take it the same time every day. Losartan, blood pressure medicine, most people take that in the morning, but if it's easy enough to take it in the evening, then that's fine too. Again, taking it same time every day. And the paroxetine, that can be either morning or evening. Some people might get drowsy with it. Some people might get a little more activated with it. So that depends on you. So, but the most important thing would be consistently at the same time every day. Should they be taken together at different times, with or without food? How much water when taking meds? Okay, let's start with that. Medicine, unless we tell you do not take it with another one at the same time, the medications kind of know where to go. So if we say certain medications, certain antibiotics don't take with dairy products or minerals like iron, calcium, zinc, then we mean separate it by several hours. But the rest of the medicines generally you can just, if you can chuck them all at once, that's fine. The ones, if this is the same person, the ones you're mentioning, those medicines can be taken with or without food, doesn't matter. And again, we will usually have that if it specifically needs to be without food, that label will be on the prescription bottle, or if it says take with food, it'll be on it. How much water? You know, as much as to get it down. You know, you don't want it stuck in your throat, but there's no specific amount. And most people drink usually a few ounces with it. Can Nsaids or Tylenol be taken with the prescription meds? If you're talking about the ones up there, the one that Nsaids are things, non-steroidal anti-inflammatory drugs, things like ibuprofen, which over the counter is Motrin or Advil. Aleve is naproxen. Those medications can increase blood pressure. So if you're taking medications for blood pressure, you want to check with your doctor how well controlled your blood pressure is. And I would recommend not taking NSAIDs regularly, particularly in higher doses. An occasional dose is not going to be a problem. Acetaminophen does not have that effect on blood pressure, so that's the safest over-the-counter pain reliever to keep around for headaches, body aches, that type of thing, fever. Okay. OTC cold medications, truthfully, I believe the chicken soup is probably the best thing for your colds, but and any kind of fluids. Most over-the-counter cold products, I would say you don't need. And if you do have high blood pressure, you want to avoid anything that has a decongestant, anything that's like a D, has a D after it. But many of the cold medications, things like NyQuil and stuff, they have combination of different medicines in there that you may not need. You know, the NyQuil out of the sneezing, stuffy, fever, achy, whatever. If you don't have all those symptoms, you don't need all those products. Rather to take a simple thing. If you have a cough, you want to know what kind of cough. You know, I would always ask what kind of cough. Is it a dry cough? Is it a wet cough? You know, are you going to a concert and you don't want to be coughing through it? Most of the time for many coughs, just enough fluids is good. If you have a lot of mucousy stuff, even something like the Mucinex or the guaifenesin tablets can help with loosening up that mucus so that you can cough it up. And when you have a wet cough, you don't want to keep it down there. You want to cough up that yuck, that junk. If it's a dry, tickly cough, just even sucking on a lozenge sometimes can be enough. So that's when you talk with a pharmacist about the specific product and say, hey, can I take this safely? Do I need this? But truthfully, most of the time, a lot of the cough and cold products you don't need. The antihistamines are very drying. They're good for allergies, but not necessarily for a cold. And certainly these days, if you have any kind of symptoms of a cold, you want to check yourself for COVID. Any differences or advantages of coated aspirin versus chewable? So the most common reason people are taking aspirin these days is a small dose, the 81 milligrams, to prevent heart attacks and strokes. We use the coated aspirin for most people because even that small dose can, in some people, cause stomach irritation and even ulcers or bleeds. So most people do take the coated aspirin. If you know you tolerate it and you have had no problem in the past and you don't mind chewing the aspirin, that's fine. Some people, if you know, they'll say if you think you're having a heart attack, the first thing to do is chew an aspirin. So it's obviously easier if it's a chewable one versus a coated one. But that's really, you know, again, an individual choice. I'd say probably most people are using the coated aspirin. And there's also a good question to ask your doctor, do you really need to be taking an aspirin for preventing a heart attack? If you have no cardiac conditions, and you're over the age of 70, there's no proof that taking this is going to help. In fact, it could actually cause more problems with bleeding. So that's a discussion to have with your physician about what your individual risk factors are. Number 4, do OTCs such as multivitamins, CoQ10, and calcium interact with prescription drugs? They can, yes. Multivitamins, the vitamins themselves, not as much as if they have minerals in them. Like I said, certain medications they'll say do not take with certain minerals like calcium. CoQ10 can interact actually with warfarin, which is Coumadin. I had a patient many years ago when I first started here at this nursing home, and they couldn't get the Coumadin, the INR levels, the dose high enough, and they were on CoQ10. I said, let me just check. And it turned out that that was preventing the Coumadin from really working. So we stopped the CoQ10 and we were able to find a dose of Coumadin for this person. Calcium, again, can, like I said, interact with some antibiotics and some other medications. So we would put that on the label, and then you would separate it for several hours. We can talk about calcium and vitamin D for your bones, which is also a good thing. Then Shu asks, is there a benefit to do mail-in prescriptions as opposed to going to a physical pharmacy? Some insurances push you towards the mail-in. My own personal preference is to use your local pharmacies and support them, whether they're the independent or the chain pharmacies, because you want them to stay in business. You want them to be in your neighborhood for when you need them. I know that sometimes you can get a great cost break and with using mail-in. We've in New York really tried to push that if the community pharmacies can, meet all the requirements, that patients should have the choice of what pharmacy they want to use. I want you to develop that relationship with your pharmacist, that trust, which I think, like I said, you could do in mail-in, but it's not the same as being able to see the person face to face and talk with the pharmacist. So I hope that answers that. At what age should you start taking a multivitamin, if any? I don't think you have to be taking a multivitamin. The best place to get your vitamins, truthfully, are fruits and vegetables, and get them from your food, from the natural sources of them. The studies that have been done with multivitamins, none of them have really shown that taking a multivitamin is going to make you live longer or healthier. The studies with vitamins mostly is looking at like diets rich in certain different vitamins have had more effect than just taking it in a pill form. And that may have to do with, I always say, like, there's other stuff in the orange besides the vitamin C that may help your body use that vitamin C appropriately. The one vitamin we don't get much from our diet is vitamin D. And a lot of us are not getting enough from the sunlight because we're told to put on sunscreen because we're worried about skin cancer. So if there's any vitamin that people probably need to be taking, it's vitamin D. There are guidelines, probably for most people, 1,000 units a day. You can ask your doctor to do a vitamin D level to see if you have enough vitamin D. Some people who are very deficient may need to get a prescription vitamin D where they take a big dose once a week for several months, and then we check it, and then you can go on to buying the over-the-counter vitamin D in 1,000 or 2,000 units a day. And the vitamin D is important in our diets and in our bodies because it helps us absorb calcium. Calcium is obviously important for maintaining your bones, and as we get older, more risk for osteoporosis, for weaker bones. So the other thing is you want to make sure you're getting enough calcium in your diet. And if you're not, then to supplement with a calcium supplement, a tablet, there's chewable, there's chocolate, there's all sorts of calciums. The one thing with calcium is to not take more than 500 or 600 milligrams at once because your body can't absorb it all. And what most of the recommendations are now is get as much calcium as you can from your diet. And most of us maybe will get that 500-600 milligrams a day. And for older adults, we want like 1,200 milligrams of calcium. So if you take one extra calcium tablet, then you're probably good. There's calcium carbonate, there's calcium citrate. Calcium carbonate requires acid for absorption. So if you're taking any kind of acid suppressor medication like Pepsid, famotidine, or Prilosec, Nexium, any of those, calcium citrate may be the better way to go. Or make sure you're taking your calcium with food that will still provide some acid secretion. So that's something, again, there's so many different calcium products. You could ask the pharmacist for some advice on which one would be the most cost effective, easiest to swallow. Like I said, there's all different versions of calcium out there. Any other questions?
No, that was wonderful. Thank you, Dr. Beizer. If any participants have any other questions, feel free to type it in the Q&A or the chat box, and we can have Dr. Beizer address your questions. Oh, I see one more.
Okay, let me
Just try to grab it.
Okay.
Second. Oh, here you go. Oh, I'm just going to read it to you.
Okay.
Sorry. Is orange juice okay with calcium?
Yeah. In fact, a lot of times the orange juice is supplemented with calcium. So that's, I think that's what they mean. And the orange juice with calcium is kind of, for people who maybe are sensitive to dairy products, and they put in just about the amount of calcium in there that's in a glass of milk. There's other sources of calcium besides dairy products. And there you can even Google that. I have a list here that I usually keep, but just to think about other places of calcium. Certain green leafy vegetables, collard greens, turnip greens, kale, sardines with the bones, or canned salmon. If you ever make canned salmon, like a salmon patties, they have all those little vertebrae in there. Just crush them up and eat those too. Many of the nut milks also supplement with calcium, so that you're getting calcium from, the almond milk, things like that. Milk is also supplemented with vitamin D, but it's not a lot of vitamin D. It's only 100 units per glass of milk. So you're really not getting a lot of vitamin D from the milk. It really is the sun, or, if you're eating, cod liver oil or something like that, or really taking a supplement. And that's really the one place you're going to get it. Other vitamins we supplement are grain products with folic acid, and that's particularly for women who are of childbearing age, to make sure they have enough folate in their systems to prevent neural tube defects like spina bifida. If you are in the diabetic track, what is the best milk you can drink without getting the carbs? There's some thought that actually whole milk might be better for diabetics because they've got the fat, and then it's absorbed slower. But that you'd have to really talk with a diabetes educator and seeing what they recommend. I don't know about some of the different other, the oat milk and almond milk and things like that.
Great. I have one more question.
Okay.
Are keto supplements safe?
Keto supplements. I don't have enough information on that. I don't know why they're taking it. So I can't answer that. You have to be cautious with the supplements. I was with one of the students, and we were a senior group wanted us to talk about supplements for memory. And you've probably all seen the commercials for Prevagen and Nariva and all these other kinds of things. And we just kind of, did a Google search and went on Amazon, and it's scary, the stuff that they're selling that they think is going to promote your memory. And even when you look at something like Prevagen and they say all the studies, it wasn't studying people with dementia. So these are not things that are going to prevent Alzheimer's. And there's a lot of stuff in these things that are not proven, and really, even ginkgo, ginseng, all these things have side effects. Those will interact with medications. Truthfully, the best thing that they found for cognition, for memory, is physical exercise. Physical exercise, learning new things, Even things like doing the crossword puzzle hasn't necessarily been shown to be as effective as being active. So don't waste your money on all these supplements. I've seen people spending hundreds and hundreds of dollars on supplements. And, you know, we don't know all the interactions that they have with medications. We don't, you know, have enough data on some of these things. And a lot of it is a waste of money. And when you read it, it's really scary.
Great, thank you. I believe you've answered every question.
Okay.
Thank you so much. And I think we are okay. If anyone else has any other questions, please feel free to email me and I can get the questions to Dr. Beizer to answer when she's available. But I'd like to really thank you so much, Dr. Beizer, for your expertise, for your time today on this really important topic of how to manage your medication. I think this was such an informative, insightful, and super helpful session. You addressed many items that I didn't even think about. I've never seen the pill splitter and the variety of just how many pills, you know, one can take, depending on your situation. But I hope that everyone that joined us today enjoyed the session. This recording will be sent to you for future view. We will be uploading it to our YouTube channel and we'll share it wherever we can because I think this is such an important topic and everyone needs a pharmacist on their side to guide them along the way. So thank you so much. And I also wanted to alert, you know, many of you, if you are available, we are having our on this Saturday at 10 a.m. We are continuing our fitness journey for the new year with body and brain. So if you're available for a yoga session at 10 o'clock, please feel free to join us. It's a lovely, lovely session, and we'll stretch and move your body to build strength, flexibility, and improve your balance. And then in February, we're going to invite Rosa Yan, who's the director of the Multicultural Affairs at St. John's University. She's going to come and speak and share some information about Lunar New Year. It's the year of the tiger, so come on and join us. And then March we'll have a whole Women's History Month session for you. So starting with Professor April Miranda. So we have a lot of faculty coming to come and speak with us. So thank you very much. And then if you're in Florida, St. John's is returning to Florida at the beginning of March. So, make sure to check our alumni site to see all the great events that are planned for you. So I think I might have had one more question for you, Dr. Beizer, but no, I think we're good. It's just many, many thanks for Dr. Beizer. Thank you so much for taking time out of your day. And thank you for training the next generation of pharmacists. I think, we can't thank you enough. So thank you so much and be well, stay safe, and thank you again.
All right. Bye-bye.
Bye. Thank you.